in your career, have you seen anything like this in terms of outside of simulations, I suppose?
Right. No, that's an easy answer, Ryan. Absolutely no. And I can vouch to the audience that there are only 3 of us in here, and we're pretty distant from each other. But no, Brian, these are unprecedented times. Whether you're a physician, whether you're a nurse, whether anybody in the public, and so, I think it's a time though that we're all galvanizing. We're coming together in spirit, staying apart, right, physically. But no, it's a time that things are changing day by day. And as we were sort of setting up for this, I was checking my phone, not to be asocial, but because emails and texts are coming in just real time with changes.
Well, and you being the CEO of Metro Health, University of Michigan Health, is, you're quarterbacking this whole thing with a lot of help and experts.
Absolutely.
But just when did Metro Health's radar really go up and start to plan, for our community? Because you're such a big part of keeping everyone here healthy. You're a big hospital system here. And when did you get wind of okay, this has my attention now?
Yeah, I think as a healthcare system, just like our sort of sister organizations here in Grand Rapids, all around the state, we've got great plans around disasters and protocols. In terms of COVID-19, really, I think the alarms for us as healthcare systems were taken off probably in about the last 2 weeks. The world has changed in the last 1 to 2 months, but really, I think locally, probably in the last 2 weeks, really realizing the extent of what could happen, and really just also looking at what's happened in Italy, I think has really informed the way we think about it, informed the way that we plan for this. I do want to speak to just the spirit of collaboration between Spectrum, St. Mary's, and us. I'm in touch with my counterparts there regularly.
Yeah.
And it's great to be working together. But the last 1 to 2 weeks has been really crucial.
Well, I think that's great to hear because in my industry, there's and as healthcare has expanded in our region, we're a growing, thriving economic region. So there's lots of opportunities for growth for healthcare systems. There's kind of a gloves on, time to put the gloves on and time to take them off. And it sounds to me like, now's not the time to, it's a time to come together and pool resources and talent and keep an eye on our neighbors, whether we're sister healthcare systems, as you said, or just partners in the community.
Absolutely. I think there's, I was on a call with Governor Whitmer and other hospital CEOs a few days ago, and we're all facing the same issues really and concerned about the same things. And I think the government has stepped up to make sure that we feel taken care of. But I can't stress enough really from a healthcare perspective how important that term flattening the curve is.
Yes.
Right.
So let's talk about that. Just for I'm hyper aware of it. I have two children with some heightened exposure risks, and so my wife and I's ears been to the ground. But by flattening the curve, I think most people are familiar with that term. But can you just tee it up from your perspective, professional perspective, why that's so important, what it means, and why it's so important?
Right. And I think a lot of folks probably a month ago had never really heard that term. Now it's as ubiquitous as go blue, right?
Right.
And it's interesting because really that term flatten the curve was coined by a U of M professor, Howard Martell. And it really, he was studying the 1918, that big flu epidemic that really affected this country, and really looking at cities that really did well through it and other cities that did not. And what really became clear is just the significant importance of social distancing to really curtail that big spike in cases. And the reason that big spike is so concerning is that as a country, we have a very defined set of hospital beds, hospital providers. For a country of 300 plus million, depending on what you read, we've got about 800 to 900,000 hospital beds. So if there is that big spike, it's going to overwhelm the healthcare system. Whereas if you flatten that curve, you know, we can stay within our capacity.
Right. And just to plus on to that, from my understanding, and you can correct me at any point in this conversation, but the idea is not to, you know, we may still get infected, but if we don't get all infected in these huge waves that crush everything, that's really the danger. As you spoke to Italy, maybe you can relate to how the curve was much steeper there and what you've learned from Italy and how that applies to all our efforts to flatten the curve here and limit our social interactions.
Yeah, a little bit of a personal hit for me. I did some of my training actually in Ancona, Italy, and so I'm very aware of how modern that healthcare system is. I mean, it's an amazing healthcare system.
Yeah.
And really to see them overwhelmed by really that curve, that spike, to see their ICU beds just completely filled, to see providers, you know, dying, actually, you know, physicians and APPs and nurses. So that's really informed us. I think that really sounded the alarm bells for us in this country. So this social mitigation has been key to really flatten that curve. I think we're going to really see in the next 10 to 14 days how successful we've been. Hopefully, we've been very successful.
What's the testing sort of resources you have at Metro now, and how are you feeling about capacity to test more broadly other than the maybe a narrow parameters that people have to meet to get tested now?
Sure. So, Brian, I think one thing, though, that folks need to understand is that in general, the vast majority of people who get infected by COVID-19, that it's actually quite mild, right? The typical symptoms are fever, dry cough, and then perhaps dyspnea, shortness of breath. And so most people will have a very mild illness, and it's really, our concern is for the elderly, for folks who have an underlying comorbid condition, whether it's lung disease, heart disease. So it's really going to be a small fraction that actually end up getting hospitalized.
Right.
But of those folks, about 20% will end up in the ICU and really with severe disease. So that's the folks that we're very concerned about.
Yeah.
So testing has been limited, but on the flip side, again, because there's no specific treatment for COVID-19, there's no specific antiviral medication, no specific antibiotic. There are studies underway, but right now it's all supportive care. So for the vast majority who have mild COVID-19 disease, really the recommendation is almost the same as for a common cold or influenza. It's to really quarantine yourself at home, right?
Right.
Take precautions. And then for the rest of us, really washing our hands, you know, not touching your face and things like that.
But it's so important for us to limit healthier people who might be asymptomatic or only a little bit sick or think they have allergies or a small cough, seasonal flu, from spreading it to people who are much more vulnerable. And so that sort of mixture of messaging, I know Metro Health's been very clear about those things. But how do we get to people to really pay attention who are feeling like this is a little bit overblown or a little bit, too dramatic in the media?
You know, Brian, I really do think people are getting that message.
Good.
I live downtown and had to get some water and walk to a local store. The streets were deserted, right?
Yeah.
It was almost a little concerning in Grand Rapids, Michigan, you know,
Right.
think about that. But I think people are getting that message. They are getting the importance of that social distancing, just as you said, because you can feel mild symptoms or maybe have no symptoms, but still spread it to others. And again, if you spread it to somebody who's older, who has underlying disease, I mean, that can truly be very serious and ultimately lead to their death, perhaps.
Sure. Can you talk a little bit specifically about just our community in West Michigan? And you talked about the partnership with your sister healthcare systems being Mercy Health, St. Mary's is what it used to be called, and then Spectrum Health, just in terms of collaboration. And are there, what sort of specific efforts are there to help each other through this time as you prepare for probably a likely surge of people that are infected and need some of that respiratory care, some
Right.
of those more serious symptoms?
No, there's been a lot of collaboration. Again, I talk with my counterparts there pretty often. Just an example would be around the visitor policy. We wanted all three of our systems to send a unified message to the community around the visitor policy. When Governor Whitmer first announced it here locally, it's hard to tell patients' families, you can't visit unless, A, B, or C, and there's some strict criteria around that. So we wanted to send that message out together just because, again, just the absolute importance of social distancing.
Yeah.
This is the way we're going to stem the tide. Very likely we will see a surge, right?
Yeah.
How big that surge is, we don't quite know. But the more that we can do this social distancing, I think the smaller the surge that we are going to see.
I'd love for you to speak about Metro Health's staffing and physician care and how they're handling the situation and sort of plans that you've made to be more effective in terms of covering and caring for COVID-19.
Yeah, Brian, the health and safety of our patients, number one, and the health and safety of our employees are of utmost importance and the biggest priority. And so we want to be sure that we're supporting our staff through this, both our clinical staff as well as really our non-clinical staff as well. So we've strongly encouraged, going back the last 2 weeks, that anyone who can work from home should. I mean, pretty much mandating it, in fact.
Yeah.
Number two, there are clinical folks like nurses and doctors who can't, obviously, and they embrace that. They want to take care of patients. But we want to make sure that if they are exposed, number one, that we can support them. So we've got some very progressive and innovative ways to do that, including really being very flexible with PTO, giving them more PTO. We've got something called the STIB bank that, again, provides them more time. We've opened up a childcare facility that obviously we're operating gratis for their children, really utilizing just the best, sort of the distancing we can with that.
Yeah.
We've also had all now clinical staff in the hospital and in the clinics wear masks. Really, the initial guidelines from the CDC, and probably still true now, is that if you've got a patient coming in with respiratory symptoms, we get them into a different area right away, right?
Right.
They have a mask on, and so when the patient has the mask on, that's very effective in terms of preventing spread.
Sure.
But I get the concern from clinical staff. We get it, and so we're making sure that all our clinical staff actually wear masks now throughout the hospital, throughout the clinics. In terms of our clinics, our outpatients, we've got 18 sites all around the community. What we've decided to do is to not only obviously protect patients, but also protect our providers. So we have 3 of those 18 sites that will see patients who are coming in with illnesses. We've got a hotline that patients can access that will direct them to the ED perhaps, or one of these 3 sites. But the vast majority of our outpatient visits, seeing physicians and APPs, will be done through digital, virtual.
Yeah.
So we were going to do a big launch of our digital platform this summer, our app and everything. We've actually accelerated that.
Sure.
So within the next week to 10 days, that'll be rolled out so that all Metro patients and community patients can access appointments through digital.
How can we impress upon people that this is extremely serious?
So I think, again, that flatten the curve concept is so important in this discussion, because one of the key parts of that is the U.S. healthcare system and really the world healthcare system, there's a defined capacity right now. There's a defined number of beds. There's a defined number of healthcare providers. COVID-19 spread so quickly. There's so much connectivity throughout the world that if there is that big spike, it will just overwhelm us. And I think that's one of the big differences with, as important as influenza is and other diseases, that, COVID-19 has a much better chance of causing that big spike, overwhelming the system.
Sure. Well, and that's just to speak as this is a separate new event. It doesn't decrease the amount of people who may need ER care for a car accident or for or normal influenza that they might have seasonally, or cancer or whatever. It just complicates the resources and can put additional people at risk that don't even have COVID-19, who are just need health care because this, and it could exacerbate things for people who might normally have a positive outcome. It may not be possible if the system's strained to this point. So I just have seen that in the argument a lot. It's frustrating to see, people consistently go back to this trope about, well, why are we taking this so seriously because X, Y, and Z happens? Well, we're adding an entire layer of ramped up, accelerated demand that we can help to prevent by limiting our interactions and stopping the spread. So that's my understanding. Does that seem to be
That's absolutely right. And, the curious thing, not curious, but the thing, Brian, is even with influenza now, we're seeing actually lower rates of influenza given the time of year compared to previous years. And one of the really thoughts behind that is because of the social distancing we're doing because of COVID-19, that it's actually having an effect on influenza spread.
Sure. Well, we're not transmitting all kinds of things now because of our limited interaction.
For us at Metro, we utilize the state lab. And within the next 2 to 4 weeks, we will have the capability to test in-house. And the advantages of that is a faster turnaround, 4 hours versus when we send it to the state, it can take 2 to 3 days.
Yeah.
And Michigan Medicine has started testing in-house 2-3 days ago, and other systems will continue to come online. And so the amount of testing available will greatly accelerate here in the next couple weeks.
Yeah. Well, that's good news. That's great news. Yeah, and then just the supply chain of masks and things and those sort of durable goods. To have one of the key, everyone thinks of healthcare providers with masks on, and that's one of the things we don't have right now.
Yeah, that's, China in many ways has been our supply chain for a lot of things, and masks were one of those. And so I think, again, this is a tipping point for this country in the way we think about supply chain. We've been fortunate. We've really worked hard behind the scenes to secure enough surgical masks as well as the N95 masks that are used for airborne isolation. So we're in a good position with that. We're certainly willing to help out others if it came to that. But I think that mask situation is concerning. We follow it day to day. So in our incident command meetings, twice a day, how many masks do we have? How many days supply? We're in a good spot with that, but it is concerning, and I think it's going to change the way I think the whole country looks at, where we get them, how we get them.
Sure. Yeah, and it just underscores the interconnectivity of this world. So we're seeing it play out in a pandemic and how connected we are and how easy it is to transmit things, but our supply chain for simple things and what doesn't matter. It's such a global, tight-knit infrastructure now of how we get anything.
Absolutely.
Food versus, packaging to core supplies. It really just underscores how much we're connected as human beings and how just one little disruption can really create a domino effect that you're quickly trying to
Absolutely,
undo the bell. This Full Exposure podcast episode has been made possible through the support of Metro Health, University of Michigan Health, and Dr. Peter Hahn, who believe that creativity and the arts are essential to a rich, healthy, and fulfilling life.